And I have some of my women who will say, I was a bedwetter. And, then I grew out of that, but now I'm older and I'm wetting the bed. So, does this mean something's wrong with me? And that's what
Right.
I try to really instill in my patients. You're not broken. There's nothing wrong with you. I help teach them the anatomy and how their body works because,
Mhm.
especially, my female patients, we talk about nobody really talks to us about our anatomy, right?
Mhm.
Nobody
Right.
really, you may get a little information when you're getting ready to start your period, but
Uh-huh.
otherwise, it's just you're on your own unless you have problems, pain with sex, or pregnancy related problems. You really don't have any information. And then you
Right.
get to perimenopause and menopause,
Mhm.
and you don't understand the hormonal changes. And you're like, my
Right.
gosh, I'm broken. And or you think, this is just normal. My mom or my grandma and my aunt always wet themselves. So I guess this is me. I'm just getting old. And it's
Yeah.
like, no, you're not. So
Mhm.
it's just, there's a lot of education um, that goes with this.
Exactly. And which leads me to my next question because there are so many symptoms that we have sort of normalized over the years. We do not think of it as a symptom or not knowing it. We do not even know that there's help available, especially with
Right.
women. What are the most common symptoms that people have normalized for years that they could be related to pelvic health?
So like with sexual intercourse, so some people, some of my women will say that it's just normal for sex to be painful. Some of that may be from their background on how they've looked at intercourse, but some of it is because they carry that into their body. It's they have muscle tension down there and they have pain, but they just think that's part of sex. And so until you start working with them and tell them it doesn't have to be like this, and
Mhm.
let's look at these muscles, they're shocked that they don't have to live like that for the rest of their life. Same thing with women who start having leakage. One of the first thing I'll ask is, when was your last bowel movement? Because studies have shown with kids too, if you have constipation,
Uh-huh.
that's gonna put pressure on your bladder. You're gonna be more likely to have accidents. So I
Oh.
always ask about, bowel issues, even if I'm talking about urinary incontinence, because
Mhm.
they're together, because of how our anatomy is. It works
Oh.
together.
That's interesting.
So,
That's actually eye-opening
yeah,
to think your bowel movements and the incontinence is related,
right.
correlated.
And then
Uh,
and then it kinda keeps going because if you're constipated, men, women, or whatever, and we tend to hold our breath and strain, then for women, that can lead to prolapse. That,
mm.
because you're straining all the time.
Oh,
So
that's
it's
awesome.
one of those things you're trying to be preventive. And I've had women that have come in that have had urinary incontinence forever. But they say, I don't want an internal exam. I don't want a pelvic exam. I don't want anything like that. And so I just put them on a bowel and bladder program. And a lot of them get better just like that.
Oh, wow.
They have no complaints of leakage.